So, Simon, we've had lots of conversations about detoxing, and there's a lot of marketing and a lot of confusion out there, and we're really trying to bring to our listeners today, what is the myths, what are the facts, what are the truths, and what do people really want to do if they want to detox? Because you and I are both promoters of detoxing, and people should do it at least twice a year. Get rid of the body's chemicals. We ingest chemicals every day. When you walk outside, you got the asphalt, the heat coming up, you're breathing in chemicals. You got them water bottles that are sitting in cars. You got the air we breathe. You got all the chemicals that they put in foods that we now eat and ingest. You got even your medical drugs, prescription medications. And the only way the body really eliminates these toxins is you eliminate it through your stool, you sweat, you have urine, and the rest goes through your liver. And we're going to really get into the details about how detoxification helps and how you really kind of have to boost your liver and allow the natural process to occur and get rid of the toxins and chemicals. So, Simon, we know there's a lot of benefits with detoxing. If people have fatigue, they're having weight gain, they have low immune function, we're already starting to go into allergy season. I know that I was talking earlier about how I'm experiencing some of this stuff myself, so it reminded me it's time to do a detox. You get better skin, your better hair. People are having hair loss. They're getting that weight gain. A lot of people are plateauing on weight loss. And even the anti-aging and even that foggy brain, muscle aches, joint pain, this detoxification can help so many people out there. And there's really, I don't feel there's anyone out there that can't benefit from a detox. What do you think?
Yeah, 100%. You're 100% correct about that. The question is, we talk about toxic burden, and the question is no longer if we are toxic, but how toxic are we? And you're right. In the beginning, you stated about how our bodies naturally releases the toxins and what have you, but sometimes we need help. And the problem and the situation is with that, a lot of people are misinformed. Right? You said it exactly. You go online and you get 1,000 things online about juicing and the benefits of juicing, the benefits of a cayenne, lemon, pepper drink or what have you. You're talking about celebrity detoxes that are endorsed,
It's the new hot crave out there is going on a detox, lose 10 pounds. But really, beneficially, these detoxes out there that are being marketed actually can be dangerous to our listeners out there. And when you're releasing all these toxins, they're not getting the nutrients they need. How much nutrients can you get from water, cayenne pepper, lemon juice, and starving yourself and putting your body into that shock for 10 days.
Yeah, and that's exactly it. And with what we wanted to talk about today for your listeners is to help them do it, do a detox, a natural detox in a healthy way that's been clinically studied and has had over 20 years of success. What we will talk about in a little bit is metabolic detoxification versus just detoxification, and there's a difference. And metabolic detoxification is when the body normalizes itself. Your body normally detoxes. It gets rid of the toxins from your body. It enters, and I think you're going to talk a little bit about how it works with that later on in phase 1 and phase 2 of your body and how toxins enter your body and what have you. But a good detox will help your body, help the body levels normalize this and also help increase certain ways to get rid of the worst toxins in your body, such as heavy metals and everything like you talked about.
Yes, and we do want to touch on that. Heavy metals, people don't think that they're heavy metal toxic, but we were just talking, even the CDC has reported that every American has heavy metals in their body. And we get this, and we actually do a scan that we do in our office. You actually just put a probe on it, tests for tissue concentration of heavy metals. And get your test results in 10 minutes. And then they can follow up with a good detox that's going to help them eliminate this. You get these heavy metal exposures from even cooking. If you're using aluminum pans, what about dental work? Anybody that has a cavity and has a filling in your mouth, guess what? You got mercury in your mouth. So we've seen, even on patients that come in and get the scan done, they're coming back in the high levels. And how healthy can that be for your body? Then we add all the other things that we're exposed to. You're on a prescription medication, a blood pressure medication, a cholesterol medication, and all these things break down to chemicals. We're exposed every day to environmental exposures. Every time you walk outside, even inside. What about cleaning products? For those of you that are out there cleaning this Saturday morning, all the chemicals that you're exposed to. If you have an alcoholic drink over the weekend, guess what? You just ingested chemicals. You put lotion on this morning. You took a shower this morning. If you read the bottles of products that we use, and even the plastics that they're in, our body is absorbing that through one of the biggest organs, our skin.
Right.
And that's how we become toxic. And it just overloads the liver, the kidneys. You can't sweat it out. You can't pee enough. You can't excrete enough stool. And the body needs help to get rid of that.
Right.
It's going to help people that have that foggy brain, have muscle aches, have joint pain, fatigue. What about poor sleep? I can tell you we're here in Las Vegas and it's a 24-hour town. How many people sleep great out there? And it can really benefit